think like the media and just what our common knowledge of eating disorders, most people's image in their head is like an emaciated young female. And that's just, definitely not the case. Two males, let's say, could be on the same, wrestling team, and there's a lot of focus on weight and being lean and that sort of thing, and may have the same experiences. And one might be predispositioned genetically for an eating disorder, so their brain is wired differently. And one is not. The one who's not, is not going to develop an eating disorder. They're going to be able to deal with all of that. The one who is the one who may. And then the other thing I think a lot of people don't necessarily realize is a lot of times eating disorders are developed because of.
All right. Well, welcome everyone. Thank you so much for tuning in. I am so excited about today's conversation where I am joined by Melissa Giovanni. She is a registered dietitian and the owner of Balanced Nutrition Counseling. And they have two locations here in the Middle Tennessee area, one in Nashville and then another in Murfreesboro. They also do virtual coaching and nutrition counseling as well. But I'm super excited about this conversation today. And Melissa, again, thank you so much for joining us. And I'll just kind of turn it over to you, just kind of give our listeners here some background information, kind of tell us how you got started in this field and what you all are doing currently now at Balanced Nutrition Counseling.
Yeah, for sure. Thank you so much for having me. I'm excited about it as well. So I became a dietitian a little bit later. I went back to school in my later 20s to change careers and whatnot. My grandma had cancer and I felt like she was getting no nutrition support at all whatsoever. So it kind of triggered me to look into that field and help people with nutrition counseling. And then I also have, my own experience with disordered eating and seeing friends go through eating disorders and whatnot. So I kind of knew I wanted to work with that population. So I went back to school and got my master's degree and became a registered dietitian, and then worked at a couple of treatment centers working with eating disorders, and decided to start my private practice. So we have a small group private practice in Nashville, and then also Murfreesboro and virtual, like you said. But we all work with eating disorders and offer individual nutrition counseling, and same with families and couples too. We'll see a wide range of ages. We work with adolescents all the way up to, adults in their 70s, 80s. So we see a lot of different things. We also offer services for other medical nutrition therapy too. We see clients with diabetes or cholesterol and things, high cholesterol and things like that. But specialized primarily, I'd say probably 90% of our clients are eating disorder.
A wide, even though you specialize in eating disorders, like you said, but sounds like also a wide range. The elderly population, are those like more of your disease, diabetes, metabolic disorders, or do you see eating disorders in that population as well?
Both. We see some, heart disease, things like that, or osteoporosis, osteopenia, that sort of thing in the older population. But we do have clients also with eating disorders who maybe have had support and help throughout their life, or sometimes someone in their 60s, 70s are reaching out for the first time and maybe never even realized they had an eating disorder or knew something wasn't quite right, but never had that support. Also, the eating disorder field, it's been around for a while, but it's fairly newer. So it looked a lot different like 50, 60 years ago. Support would have been a lot different, even 20 years ago than right now.
Okay, great. And I do, before I ask you more questions, because I do want to get into the eating disorders a lot more in depth. But can you kind of explain and the difference between a registered dietitian and someone that does nutrition coaching? So I have a lot of friends that are personal trainers, and part of their business model, they teach their clients different nutritional techniques to help with whatever they're teaching them, whether it's to build muscle or whether it's to lose fat or anything, of that nature. So, but I do know that a registered dietitian, you go to grad school, you're licensed. I mean, there's a lot more training. So can you kind of talk about the differences between you as a registered dietitian versus someone that can just be like a nutrition coach?
Definitely. It's similar to what you kind of just said. The primary difference in a registered dietitian and someone who is a nutritionist or nutrition coach is the education and training. So a registered dietitian is recognized as a medical professional. So we've completed a specific amount of education and licensure requirements. The requirements effective this year, 2024, it changed. We have to have a master's degree. It used to just be a bachelor's degree, and then 1,000 hours of supervised practice experience, and then pass a national board exam to become a registered dietitian. And then depending on the state, like the state of Tennessee, we also have to have licensure and apply for that. Some states don't require that. It's different from state to state. And then the other thing we have to do is maintain our continuing education credits in a 5-year cycle after we become registered. So every 5 years we have to do a certain amount of hours of education and trainings and things like that. Some dietitians also have additional certifications. So I have a certification. It's a certified eating disorder specialist, eating disorder specialist. So I've also done a lot of hours for that and taken another exam and that sort of thing. And then a nutrition coach or nutritionist, they could be somebody with a nutrition degree or some nutrition knowledge and whatnot. Or there's really no requirements. Like anybody could say that they're a nutritionist and offer those types of services. I think, sometimes it's taken maybe a little too far, someone offering nutrition services that maybe doesn't have that education or knowledge. But then other times, I think a personal trainer can definitely offer some nutrition support and discussion in a general way. Just like in my sessions, sometimes I might talk about fitness and exercise. I'm not prescribing an exercise routine to a person like a personal trainer would, but I may encourage someone to exercise and talk about what they enjoy doing and that sort of thing. So I think as long as, I try to stay in my scope of practice, but I am talking about fitness and things like that sometimes.
Yes. Okay. Yes. Thank you for clarifying that. That makes a lot of sense. Yeah, for sure. But I want to go back to the eating disorders because, first for the general population, I know for me personally, before I actually read some of your blogs and material and other things from other registered dietitians on different types of eating disorders, when I heard the word eating disorders, I would just automatically think like somebody with anorexia. So I just have an image in my mind of, the young female athlete, gymnast or runner or maybe some other sport. They have to be, or they think they have to be very thin, so they restrict their eating. And for a long time, I thought that was just really what an eating disorder was. And I didn't realize there were so many different types. So can you kind of elaborate for us a little bit on the different types of eating disorders and maybe provide some examples of types that you've seen in your experience and just kind of help us to kind of understand really how broad it is, and it's not just one, it's not just the females, and then two, it's not just restricting your calories or your food intake. So.
Yeah, definitely. That's a common, I guess, like misconception or thing that's out there. I think like the media and just what our common knowledge of eating disorders, most people's image in their head is like an emaciated young female. And that's just, definitely not the case. I think it's been kind of known to be a woman of privilege, white, young female kind of disease, and that is far from the truth. Eating disorders definitely don't discriminate. It's not about just wanting to be skinny or thin. It's a mental illness, and there's a lot of components behind that. But so there's several different eating disorders. There is anorexia nervosa, which is kind of what most people's idea of an eating disorder is. That's where someone's really restricting their food intake. And then there's bulimia nervosa. That is where somebody might be using some other behaviors. They might be binging and purging and things like that. Binge eating disorder is another common eating disorder we see. Also, I didn't say we see all eating disorders. So all these eating disorders I'm listing, we work with. Binge eating disorder would be eating, large quantities of food and feeling really out of control around food. And then there's another kind of category, which actually most people probably fall into this category of diagnosis. It's other specified feeding or eating disorder. And that's just kind of, an eating disorder that doesn't maybe fit into those boxes and like the check marks of the DSM-5, which is the diagnostic manual for mental illnesses. And then there's ARFID, which is avoidant restrictive food intake disorder. And that one's different, whereas all the other ones I've listed so far, there is a body image component there. And with ARFID, it's not so much about wanting to change their body, it's about something else. So they're avoiding food for another reason. It might be, an example of that might be a kid who choked on a particular food when they were young, and then they were afraid to eat and didn't eat enough and lost a lot of weight, and they were malnourished, or failure to thrive and that sort of thing. That could potentially be an ARFID case. And then there's also pica, which is the eating of like non-food items. I feel like there's several like TV shows out there of that one that people see, eating like paint or foam or things like that. And that could be from a nutrition deficiency or, other reasons. So we see that as well. And then another common eating disorder it's not in the diagnostic manual at this point. It might be in the future, but it's called orthorexia. And that's more common recently. That's the obsession with healthy eating. And being so that, can be a little hard to figure out in our culture and society right now. Everybody's really into health and wellness and that sort of thing, which is, fine if it's not taking over your life. But orthorexia would be like an obsession. It is taking over someone's life. And there's a lot of anxiety if they're not able to eat those healthy foods and things like that. So those are the main primary eating disorders that we see. Another common term, I guess, and I didn't mention this, eating disorders, like I said, don't discriminate, but they are common in men as well, in males. And one eating disorder, again, not in the diagnostic manual, but it would be called reverse anorexia. And it's typically in men, and it's an obsession with wanting to have lean body mass. So like a lot of muscle and muscular. And again, not just a desire, it's an obsession, and there's a lot of anxiety included in that.
Okay, so it sounds like, and I'm glad you broke that down because I learned something just in your 2 minutes of explaining that. So it sounds like it's more mental than it is just them deciding to eat or not to eat.
Yes.
It's more about how that decision affects their lifestyle. So even the last one you mentioned, I'm a male, so I can definitely see that. And I know a lot of friends, and I've been that way too in high school, where you're like trying to bulk up, you're trying to build muscle because you're playing football or whatever sport you're playing. But it sounds like when it gets to a point where it's like an obsession, where you're always eating or always trying to get protein or whatever supplement you get. Sounds like that kind of gets to that tipping point of becoming like an eating disorder. Is that a fair summary?
Yeah, it is. Because so an eating disorder is so like someone's trying to think of a good example, like two males, let's say, could be on the same, wrestling team, and there's a lot of focus on weight and being lean and that sort of thing, and may have the same experiences. And one might be predispositioned genetically for an eating disorder, so their brain is wired differently, and one is not. The one who's not, is not going to develop an eating disorder. They're going to be able to deal with all of that. The one who is the one who may trigger their eating disorder to be so focused on weigh-ins and eating a certain way and doing all of that stuff. So then that's the person that would develop an eating disorder from that.
That makes sense. Wow. Now, are there any, let's say I'm a teammate or a coach of that wrestling team. Mm-hmm. Are there certain warning signs or things that coach or teammates can pick up on to say, I think this person might have an eating disorder. Let me refer them to if our school has a registered dietitian, or maybe it's the athletic trainer. That's that first person that they'll go see, or whoever. Mm-hmm. Are there certain warning signs that a coach or teammates can look out for? or something
Yeah.
like that?
Yeah, definitely. I think some common things to look out for would be like a preoccupation with weight loss or food, calories, counting calories, dieting, that sort of thing. So, like, it's taking up a lot of their brain space, a lot of their conversations, things like that. Refusal to eat certain foods, so like eliminating whole food groups. Again, someone might do that without an eating disorder for a variety of reasons, but that could be a sign of an eating disorder. Someone cutting out, all carbohydrates or all fats. Making like excuses to avoid meal times or social meals and that sort of thing, or any situation involving food. Developing kind of food rituals. So someone maybe, again, some of these can be preferences. Some people may just eat this way, but like eating foods in a particular order and finishing one thing and then the next thing, or excessive chewing, just kind of like moving food on their plate to make it look like they're eating even though they're not. A lot of like isolating, with eating disorders is just like not hanging out with their friends or talking to the same people they normally would. And not finding enjoyment or participating in the same activities as usual, like extreme concern about body image and size and appearance, mood swings, like their moods change pretty quickly. Those would be all the mental kind of emotional or behavioral ones. And then physical signs, would be more like fluctuations in weight, noticing if someone's weight is jumping up and down a lot of gastrointestinal symptoms, so like stomach problems, always having a stomach ache. In females, obviously menstrual irregularities. Obviously, that's not something you may notice, but like a friend could say it to a friend, I guess. Difficulty concentrating, really tired, low energy, that sort of thing.
Yeah, I'm just taking in on the information because I'm again learning so much just in our short time and just in your short discussions of this. So you talked earlier about kind of the wide spectrum and age range of individuals that you see with eating disorders, but is there like a certain age group that you see more of than others in your practice?
Yeah, I would say like teenagers until, excuse me, teenage to like 40-year-old females are probably what we see the most of. And I think that primarily is because that tends to be who's reaching out for help. Occasionally we have, men calling and whatnot, but I would say it's generally females. And I think that's because there's still like a lot of stigma around, a man maybe having an eating disorder and that sort of thing. And so that they're also not included in a lot of the research. If you look at eating disorder research, it's going to be mostly based on, females. In that population, and a lot of the younger population too, since it has been looked at. Even medical professionals years ago also thought that it was just young white females that got eating disorders. The other thing in our practice too that I also like to point out is we don't take insurance, and it is expensive to see a dietitian and a therapist and a psychiatrist and do all this stuff. So I think we also are kind of pigeonholing who can get help too. So it is people who are maybe a little more financially well off too that are probably coming through our doors a lot of times, which is unfortunate. We do offer sliding scale rates and can provide super bills to clients for them to potentially get reimbursed for insurance, but insurance companies generally don't cover a lot of eating disorder services, which is a disservice to people who need the help, unfortunately. So I think we see what we see, and it's probably pretty skewed.
Okay. Yeah, that makes sense. And I completely understand and agree with the insurance thing. That's a separate discussion for another day. And it's unfortunate that I have this discussion every day, like, just certain things that our patients need, their insurance don't cover. And depending on the individual's, situation or their preference, they may or may not be willing to to pay that out of pocket. So yeah, you understand, because we deal with that too in our practice. But great. So, and again, another question kind of along those same lines as we begin to close, but with that age range and females primarily more than males. Are you seeing that because of, or with that population, are they dealing with eating disorders because of, and this, I don't know if you'll be able to answer this question specifically because it probably depends, but are they like athletes? Are they, dealing with these eating disorders because it's tied to a performance aspect from an athletic perspective, or is it just solely body image? Maybe it's their home environment. Maybe it's other reasons why they're potentially have low self-esteem for other reasons, and then that kind of leads to eating disorders. Like, what is your thoughts on that and your observation and your experience?
Yeah, it does definitely depend. I think it could be either of those things or some others. I think some people struggle with an eating disorder because it was triggered by like their middle school health class. They had to do an assignment where they had to log what they ate, and their teacher talked about good foods and bad foods and that sort of thing, and that sort of triggered their brain to start making changes and restricting their food, and then they developed a full-blown eating disorder. Or it could look like because of athletics and whatnot, and maybe gymnastics, dance, wrestling, bodybuilding, diving, running, figure skating. There's so many sports that have a focus on a particular body type or a weight and that sort of thing, so that can trigger it. And then the other thing I think a lot of people don't necessarily realize is a lot of times eating disorders are developed because of trauma. So something, abuse or neglect, that sort of thing can trigger an eating disorder as well.
Yeah, that makes a lot of sense. Yeah, the trauma aspect. I didn't think about that, but that makes a lot of sense. That
and also I didn't mention too, our society and like culture, is pretty obsessed with looking a particular way and eating healthy and all that sort of thing. So that's another, I think, big contributor right now is just the like social media and comparing to other people and that sort of thing.
Yes. So, but Melissa, this has been extremely valuable. Learn a ton in this short 20 minutes that you're talking. And I know our audience, our listeners, my patients that I'm going to share this with are going to also, learn a lot from it as well and see and receive a lot of value from this. Again, I see a lot of athletes, but also have coaches, and as I mentioned earlier, personal trainers. So I know that they will share this with their athletes as well, and family members and friends, because again, this is something that I think is important. I think it happens more than we probably realize, and definitely excited to be in touch and connected with someone like you who has that expertise in how to treat this disorder. So again, I appreciate your time. And then as we close out, if you can please just give us some information on how we can reach out to you and to your staff if we have questions regarding eating disorders or just nutrition in general. We would definitely love to be able to contact you.
Yeah. Thank you again for having me. I enjoyed it and I'm glad to help. You can find us. Our website is just balancenutritioncounseling.com. And there's a contact page on there, and those emails come directly to me. You can call also, our phone number's on there and everything. And then we also have a Facebook page and an Instagram page, and our handle for that is all the foods RDs. And so that's where you can find our information and contact us, and we would be happy to help in any way that we can.
Thank you for your information on eating disorders and just nutrition in general. Just so excited and grateful for what you do for the community in Middle Tennessee and all across, because I know you have clients probably outside of Middle Tennessee. So for everyone doing all the education that you and your staff put out regarding nutrition and eating disorders. So we're grateful for that. So again, thank you so much for your time.
Yeah, thank you.